Hi, I'm Dr. Hussein Musa.
Hi, I'm Dr. Adatone Musa.
I'm a board-certified anesthesiologist, pain doctor, and addiction medicine specialist.
I'm a board-certified epilepsy specialist and neurologist.
Now, why so many certifications between us? It's because we love school.
Well, you would call that a nerd, right?
I just don't think we had anything better to do.
I think it was part of our environment, though.
It was.
Yeah.
So we both grew up in Nigerian households, and there's an old adage that either you'll be a doctor or an engineer. So I guess we proved them wrong.
No, we didn't.
No, we didn't. We're both doctors.
But it actually is a passion and a calling. I love what I do.
Absolutely.
Yeah.
Well, welcome to Healing Talks with Kingdom Docs. And we've been talking about how direct care can address some of the problems with healthcare today and fill in those gaps in care. Previously, I've spoken about chronic pain medicine and how the direct care model can give you more time with a specialist.
Mm-hmm.
On average, to see a pain doctor, it can take 3 months, sometimes longer. Depending on your network, it may take longer, or depending on your primary care physician, they just may not want to refer you to a pain doctor if they disagree that you need it.
Yeah.
I'm not saying that they're wrong, but a lot of times patients want to have the option and the freedom to see who they want. And that freedom may not be afforded to you in your current health with your current health insurance.
Yeah.
Now, direct care gives you the option to see a specialist such as myself. And one of the benefits of seeing a pain specialist is that they can delve deeper into the root cause of your pain. And not only that, they can help you, for example, if you're on pain medications, they can help you optimize the medications or remove or reduce the pain medications if they're causing side effects.
Mm-hmm.
Last time I talked about a patient who was managed by his primary care doctor. He had multiple surgeries. He got dependent on the opioid pain medications. He overused them. His doctor sent him to a specialist, myself. It normally would take 3 months, but he got there in just under 2 months because he advocated very strongly for himself. Now, with the direct care model, you won't have to do that level of advocacy for yourself. You can just go, call the doctor, and see the pain specialist.
Mm-hmm.
I think that's amazing.
Yeah, that is amazing.
Now, not only that is we were able to develop a plan of care that helped him. Not only was he able to see a specialist, we were able to address the causes of his pain.
Mm-hmm.
One thing that we changed was his lifestyle. Sometimes the type of work that he was doing was really exacerbating his pain, and we had the time to discuss what are his goals in life, what is most important. If you keep doing this, keep living this way, you're not going to have the quality of life that you want. And he heard me.
Wow.
He heard me. He understood.
Mm-hmm.
So he started doing things differently. He actually changed his diet. I remember one time, it was like 3 months because that's as quickly as I could see him. It was about our third or fourth appointment. So I'd been seeing him for about a year. One time he just came back and he was like half a person. And I was like, what did you do?
He lost a lot of weight.
He lost all this weight. And he said that his pain got better once he started losing the weight. He changed his diet. His relationship with his wife got better, and that was one of the sources of his stress. And it was because he was able to see a psychologist, and it helped deal with some of the trauma that he's dealt with in his life, which led to some of the poor habits that exacerbated his pain.
Yeah.
And now he was able to address these health issues. Now, this wasn't directly chronic pain, but what happened was that we were able to counsel. Now, in this environment, I still take time with my patients, but it's just out of my personal life. So I spent a lot of time with them.
So you integrated lifestyle changes so that overall he would get better.
Yes, and that's why it's important to really have the time to treat the whole person.
Yeah.
Now, in our experience, a person doesn't come with just one problem. Now, we focus on one because that's all we have time for. But in this direct care model, we have time for you.
Yeah, amen to that. Well, thank you guys for joining us in Healing Talks with Kingdom Docs.
Visit us at kingdomdocs.com.
Bye-bye.